Hello, my name is Sarah Halford. I'm one of the senior fieldwork managers based in the Safeguarding Hub in Sheffield, a service that deals with referrals into children's social care, otherwise known as a MASH. This is my colleague Sarah Green. She's an advanced practitioner, social worker based in the Hub, and she's going to be sharing a presentation with yourself today. Patrick.
And my name is Patrick Chisholm. I'm a lawyer with the Sheffield City Council Legal Services Department.
So we've come here today to kind of give you an understanding about how to make a referral into our service. So we are the Safeguarding Hub. We've been established since about April 2017, and we are a single point of access to screening referrals or welfare concerns and requests for support relating to children from professionals and members of the public. We're a multi-agency team of safeguarding partners with access to information and case recording systems, and we're co-located to work together so we can work together to screen in them concerns. We provide advice to families and professionals as well as take the referrals. You can ring and discuss your concern with a screening social worker. From October last year, we are now a conversational model, and what that means is referrals are to be made over the phone, and we're no longer accepting referral forms or any other form of written referral as the primary referral route. That's our main number there. Our opening times are Monday to Thursday, it's 8:45 to 5:15. On a Friday, we do close slightly earlier. If you ring outside of these times, so bank holidays, evening, weekend, it does trigger across to the emergency duty service as well, so it's the same number for out of hours. Okay, so in terms of just to give an idea of how many referrals we do deal with, so from the 1st of September 24 to the 31st of August this year, it was 37,497. So we are seeing an increase at the moment as well, so it can be about 800 a week that we are screening in, and that's for Sheffield, so it is quite busy, but it just represents in terms of what we're seeing coming through at the moment. In terms of our kind of guidance, in terms of what we're asking for you to do before you make a referral, we're asking for you to have a think about what information do you have already. We're asking you seek advice from your safeguarding lead, that you consider the threshold document that everyone should have access to, that you consult us if you're still unsure, and you discuss your concern and inform the parent where that is appropriate. What we say is that it's important in terms of thresholds, that it's not, in terms of our intervention, isn't seen as like a finish line for keeping children and young people safe, and that safeguarding does continue to be everybody's responsibility. In terms of what do we need to know, so when you're doing a referral and you're thinking about what information you need to tell us, we're looking at what it is that you're worried about. We also want to know what's working well for the family and any complicating factors that you think of, anything that you may think you're not quite sure if that is a worry, but you do think that does impact on the referral and we do need to know about it. And also what you think needs to happen. So when you're ringing us up, you want you to be clear about what it is you're asking for, what do you think needs to happen, and what do you want to see for that child. Okay, so what to do when you're making a referral. So explain what worries you most and why. So we're looking for details as well in terms of exactly what it is that you're worrying about. We're also asking for them strengths, and we're asking that it's kept focused on the impact of the child. So we're often aware that quite a lot can be happening for families, but our focus is how does what is all that happening impact specifically on the child. And we're asking that the details that you provide are accurate. We need to know who lives in that house, and we also need to know details of any other significant adults, children that are linked into that family as well. And if you can, share the child's voice. What are they saying? What are they worried about? And what are they wanting to happen? And also, if appropriate, to be sharing the views of the parents. So if it has been appropriate to speak with the parents, what are they saying? When you've talked to them about the concerns, what do they feel? Do they agree? Do they not agree? And what do they feel they need? And also, what we're saying is about notifying them about a referral being made, unless to do so would place the child at further risk. And if you're ever unsure about that, I always say just give us a ring and talk it through. We'll always direct you back if we feel you do need to be having that conversation, or we'll pick it up at that point and continue on. And this part is Patrick.
Thank you. I've been asked to say a few words about the concept of information sharing, and I think I'm probably going to repeat some of the issues that have already been raised by previous speakers. Obviously, when you're engaged in making decisions about information sharing, that is data processing. Data processing can be storing information, sharing it, can be any manner of things, but obviously one organisation sharing potentially sensitive data with another is information sharing, so you have to be mindful of the GDPR, the General Data Processing Regulation, and your obligations under it. It definitely does not mean that you are not able to share the information. The GDPR provides a number of lawful bases for information sharing, and it may be helpful to think of it in terms of a lawful pathway to share information. So if you're in a situation where you think, I need to be in a place where I share the information that I hold for a certain purpose, then you're looking for a map that shows you the lawful route you can take to get to the place where you can share that information. And there are 6 lawful bases under the GDPR. There's contractual necessity, legal obligation, vital interests, public task, legitimate interests, and consent. And you'll notice that consent is only one of those possible legal bases and doesn't have any particular validity of its own, independent of any of the others. And if you manage to find a lawful basis to share information, you've then still got the other obligations that come with the GDPR. So information sharing should be proportionate, and that would apply in the context of the previous speaker who talked about someone with a sexually transmitted disease, which may not be appropriate for sharing for these purposes. If we can move to the next slide, please. So what's likely to be the lawful basis, the lawful pathway that you would be looking to follow if you wanted, for example, to make a children's safeguarding referral? Well, it's most likely to be that of the public task, because in that context there are Section 11 of the Children Act 2014 safeguarding obligations on health care providers and others to operate your functions to have due regard to the need for child protection. So that's a public task, and it would be a reasonable basis upon which you could decide to share information. It's possible there may be other situations where other tasks could be more appropriate. For example, a legal obligation. If you received, say, an order from the family court directing you to share certain information, that's more definitively a legal obligation rather than a public task, and that might be the lawful basis. But if you're making again, to use the example of a referral because of concerns about children's safeguarding, you will have a lawful basis on the basis of a public task. If we can move to the next slide, please. So the question may arise when you've decided that you have a lawful basis, you have that pathway to share the information. Do I still need to seek consent? Well, the answer there is no. You only need one lawful basis to share information. You may then ask, should I still seek consent? I'm aware that there is guidance out there in certain places which suggests that people should still ask for consent even though they've already determined that there is a basis upon which they can share the information. I don't think that's right, and the Information Commissioner agrees with me as well. It isn't appropriate to seek consent once you've decided that you have a lawful basis to share that information. Why is that? Well, if you're going to rely on consent, it's got to be real consent and not something that someone feels bounced into. So if you say to someone, I want your consent to share this information with children's social care, but if you say no, I'm going to disclose it anyway, then that isn't really seeking consent. It's going to confuse the individual, and if you ask for their consent and then disclose the information anyway, leading the individual to think that they had a veto, it's going to be dishonest. So it's not the appropriate way to proceed. If you've got a basis for sharing information because of, for example, children's safeguarding concerns, then you use the most appropriate basis and you don't start confusing the issues. That isn't to say, however, that you shouldn't discuss your concerns or what you're intending to do with the child if they're old enough or their parent. Can we move to the next slide, please?
Yeah, so we're still saying that you should always speak with the child and family to discuss your concerns, unless it's going to put them at risk of significant harm or cause an unacceptable delay in that referral coming through to us. This ensures that the voice of the child and their parents are understood and reflected in your referral and will assist us in assessing the risk, the level of concern and the appropriate level of intervention. However, if such a discussion would place the child at increased risk of harm, then this discussion should not take place and the referral should be made without the knowledge of the parents. So in terms of just some tips of what not to do when making a referral, so don't make a referral before you've offered support that you have access to. So in particular, especially if this is one where you are thinking that this is support that the family are needing, if there's something that you could have referred on to or done yourself before, then it would have been expected that you'd have done that if the family were wanting that as well. Avoid using complex language, jargon, or language and abbreviations that are only used internally. And avoid making assumptions. We don't always know the family or have access to all the information to fill in the gaps, so making sure you share everything that you're aware of. And avoid vague and non-specific comments or language, such as self-harm or domestic abuse, without giving us the actual detail of what that is and what that looks like for that family and that child. And do not leave the child out of the referral by just focusing on the adult issues. I think I've said that previously. We need to really know exactly how this is all impacting on that child. So the impact of us if we are getting poor quality referrals is that poor information means that we are unable to make an appropriate and proportionate decisions because we haven't got all the right information, and this can put a child or a young person at risk or lead to overly intrusive interventions which disrupt the child and the family. It can lead to us spending a lot of time trying to understand the concerns in a referral, and it reduces this resource in being able to respond promptly to urgent safeguarding issues. And if they are ended up assessed as not needing a service, it can mean a stressful and potentially intrusive interventions for no benefit to the family. There are tools and risk assessments that you can access yourselves that, in terms of I've put the website on there, that if you are able to do that, we would be expected that you had looked at these risk assessments. For example, there's the DASH risk assessment. So if you are ringing us with a concern around domestic abuse, we will ask, have you completed a DASH, or has another service completed a DASH? There might be reasons why you've not been able to do that, and that's all right. Just let us know about that. There's the child exploitation screening tool, there's the FGM risk assessment, harmful sexual behaviour in children screening tool, and the graded care profile. So like I say, if you are ringing about concerns linked into these areas, we will have asked if you have looked at these tools and completed them yourself. Okay, so what happens after a referral is made? So every referral is screened in by a qualified social worker. Appropriate and proportionate discussions and checks will be made with agencies and individuals who know the children to assess the risk, and then a recommendation will be made and authorised by a manager regarding the next steps. And as the referring agency, you will be informed of the outcome and decision made, either by telephone call, email or letter. Thank you. And that's it. So it is a bit of a whistle stop, but hopefully you should have all the information there you need if you need to contact.
Afternoon, everybody. I'm Kitty Riley. I'm the designated professional for safeguarding adults and the Mental Capacity Act lead at the Integrated Care Board in Sheffield. And I'm here today with my colleague Laura.
Afternoon, everyone. I'm Laura Good. I'm the deputy designated professional for safeguarding adults with South Yorkshire ICB.
So, continue with the theme about information sharing and raising concerns. We're just going to talk to you a little bit today about safeguarding adult concerns and escalations, because we recognise that actually that's some of the most difficult things that you're faced with. So what we're aiming to get across to you today is an overview of the safeguarding adults criteria. It's very important that you're very familiar with that criteria, because that helps them with any escalation that you might need, expectations when raising a safeguarding concern, and then we'll talk about escalations. So just a little bit of case study just to put some things into context. For example, you might have a 62-year-old male who's got a range of physical health needs, including poorly managed diabetes. That might not seem unfamiliar to you on a regular basis. Recently bereaved, and you've got previously documented concerns that there's a history of self-neglect where the individual's not been accessing primary care services. There might be fire risks due to hoarding, they've been subjected to antisocial behaviour and previously been discussed in multi-agency meetings. And you're asked to attend a VARM meeting, so that's a Vulnerable Adults Risk Management Model meeting. That's been organised by Housing. So I'm just giving you that a bit of a scenario just to try and pin some of this explanation on. So within that scenario, let's break it down a little bit. So how might you recognise a concern for somebody in those circumstances? It might come about as a disclosure of abuse, whereby the adult tells you that they've got a concern and you recognise that in line with abuse and neglect. You might have a passive disclosure where somebody has noticed signs of abuse and neglect. It might be somebody else within the practice that's working with the individuals. You know, it might be unexplained injuries or bruising that doesn't fit with what the person's telling you. There might be an allegation by a third party, a family or friend, that might have observed abuse and neglect that comes about in part of the conversations with the adult. You might have a concern that's raised by a staff member or a carer. It could be that the behaviour from the adult at risk themselves starts to make you wonder if there's any abuse and neglect happening, and it could be that there's other people involved in that. It could be other adults at risk, it could be children. You could have concerns that emerge through reviews, through audits, through complaints. So just to set the scene, there could be a whole multitude of reasons why you start to suspect that abuse and neglect might be happening. And where possible, you need to be considering what the adult wants. So that needs to be your primary seed that's planted when you're starting to think about safeguarding concerns from an adult's perspective. So deciding whether you need to raise a safeguarding concern or not. So based on our earlier scenario, what you need to start thinking about is, are you concerned that an adult at risk is experiencing abuse and neglect? And we'll talk about what that might mean in a minute. What types of abuse and neglect are you concerned about? And have you had a conversation with the adult about the concerns? So going back to earlier presentations, you know, it's really good to have a conversation with people about what it is that's happening to them, so you can put that into context of what they might need to try and keep them safe. Sometimes we know that it's not always possible to have those conversations, and then you've got to use your professional judgment as to where that sits with what you're going to do next. Making safeguarding personal is a real big thing within the Care Act, and that's about trying to work with the individual to understand what outcomes they want to keep themselves safe. So that's why it's really relevant to understand their views and wishes. And sometimes you might have got a previous history of their views and wishes. If we talk about people who might lose capacity, for example, you might have documented conversations from earlier on in their care journey that explicitly talks about what their views and wishes might be in certain circumstances. And you can use all that information based on your current concerns that you've got. Have you discussed with the adult and agreed any next steps? So going back to the consent issue, and I might draw Patrick in on that from an adult's perspective, but the same kind of thing applies. You know, if you're going to share that information anyway, what kind of next steps are you going to agree with the adult? Have you provided any advice, information or signposting to other services? So what's really important when you're raising a safeguarding concern is that you don't just share your concerns and accept that adult social care will then run with that. If there are risks to the individual, that might be from a health perspective, what are you doing yourselves to try and mitigate those risks? So that's the kind of actions that you need to be taking in as well as a safeguarding concern. Have they got mental capacity to understand the risks to keep themselves safe? So all these things are considerations that you need to take on board when you're thinking about raising a safeguarding concern. I've put a link here on the bottom to some ADAS guidance, which is the Associate Director of Adult Social Services. And in there is a really helpful flowchart that helps you try to work through whether somebody would require a safeguarding adult's concern being raised. So I would really urge you to look at that because it asks you questions to think about and things to ask and work through with the adult. Next slide, please. So going back to our scenario, so you've got all these things that you need to start thinking about from an adult's perspective. We're talking about here the Care Act criteria. So when should you be sharing a safeguarding concern with the local authority? Okay, so we've got to have reasonable cause to suspect that an adult with care and support needs is at risk of abuse and neglect and can't protect themselves. So our patient here is a 62-year-old man with care and support needs. If you can keep clicking, please. The Care Act criteria says the adult has care and support needs. They don't have to have eligible needs from adult social care. They've just got to have care and support needs. So if the needs aren't being met through a service, but they still need something, that would mean that they've got care and support needs. So our chap here is 62 years of age and he has got care and support needs. So that's the first criterion met within the Care Act. Next slide, please. So the second criteria, if you can keep clicking. Oh, back one. Okay. The second criteria is, are they experiencing a new abuse or neglect? So if we look at our patient, he's at risk of abuse and neglect in terms of self-neglect. There's antisocial behaviour that could potentially be as a result of discriminatory abuse, such as mate crime or hate crime, and there could be physical abuse. So within the Care Act criteria, you've got somebody who's over 18 and they're at risk of abuse and neglect. And here in this little corner, I've put the 10 categories of abuse and neglect that's identified in the Care Act. So you've already got somebody who meets two of the criteria within the Care Act. Next slide, please. The third criteria is a little bit subjective, and you may not know the answer to this question. Okay, click on, please. So the criteria in the Care Act says that the person is unable to protect themselves from the abuse and neglect because of their care and support needs. So with our chap, we know that he's 62, he's got care and support needs, is at risk of or experiencing self-neglect, and there might be some other concerns that are happening around antisocial behaviour. And we know because of his care and support needs, he can't protect himself from the abuse and neglect. More so in this scenario because of self-neglect. And self-neglect, for anybody that's worked with individuals who are self-neglecting, you know that's really tricky. And quite often, the difficulty with self-neglect is identifying that the individual themselves are causing harm. So within this scenario, we can quite happily and justified raise a safeguarding concern with adult social care because that individual meets the criteria under the Care Act for adult social care to review the concerns that you've got. Next slide, please. I've talked about making safeguarding personal, and that's really important because we want to focus the outcomes. With adult safeguarding, in order to help reduce the risk to somebody, which is the whole premise of what we're trying to do, they've got to be on board where they can be. Sometimes people can't be because they lack mental capacity around risks and the safeguarding, abuse and neglect that's happening to them. But in terms of those people who can contribute, we should really be taking on board their views and wishes as to what they want to happen to reduce the risks. Next slide, please. Okay, so when you've established that somebody meets the criteria under the Care Act, or you suspect that they do, these are some of the things that you need to put in your safeguarding concern to make sure that when it's reviewed by adult social care at the other end, they are clear, that you are clear what the risks are. And what you have to remember is that when we come at these safeguarding concerns from our perspective, from a health perspective, we understand the health-related risks that might mean somebody needs some interventions. Our colleagues in social care might not understand some of those risks. So it's very important that we clearly define what these risks might look like and what it means to the individual if it's health-related. Okay, so make sure you've got the most up-to-date version of the concern form in the first instance. So unlike children's, we have got a safeguarding concern form that you can fill in. There's a link at the bottom there to Sheffield Adult Safeguarding Partnership where that concern form is. I would recommend using that because that's the most up-to-date one and we'll keep being updated. So you've got to be clear about what the person's care and support needs are. So if you think back to your 3 criteria, when you're writing your safeguarding concern form, make sure you specify these points. So be clear what the care and support needs are. So for this individual, we know his care and support needs are around his poorly managed diabetes, the antisocial behaviour, the self-neglect, and then you can put on there what the impact is on their health as a result of the poorly managed diabetes, for example. You need to then be saying what category of abuse that you think this person is at risk of or experiencing. And that's relying on you having an understanding of what those 10 categories are. So you need to be able to identify what categories of abuse. Now, for some people, there's multiple categories of abuse, and there's nothing preventing you from making sure that you identify all those different concerns that you've got. You need to be clearly describing why their care and support needs mean they're unable to protect themselves from abuse and neglect. And as I said, sometimes you might not know that, but it's not within the realms of, sharing information that you can't say to adult social care, I don't know that, but I've got reasonable cause to suspect that because of their care and support needs, they're unlikely to be able to keep themselves safe for whatever reason that might be. We want to understand what the person wants as an outcome. Within the safeguarding concern form, it asks you that. It's not the responsibility of adult social care to be asking the individual the outcomes. If you're speaking to somebody and you're having a conversation about the concerns you've got, it's appropriate to be asking them what they want to be able to keep themselves safe. And put that in your concern form. You also need to be telling adult social care what actions you've taken to reduce any risks, including those of an immediate nature. So if we think back to our scenario, what have you done about the poorly managed diabetes? If there are any onward referrals, have you alerted anybody else to that? Is there anything more that can be done around self-neglect, for example? Have you made any referrals to our colleagues in South Yorkshire Fire and Rescue about whether they've done a safe and well check in terms of the hoarding? You know, is there any medication, for example, emollients that the individual might be wearing that increases fire risks? All those kind of things. So if you have got any opportunity to signpost or make any additional referrals, then you should be doing that. In order to raise your safeguarding concerns, there is a form that you can complete. What we would say in adult safeguarding is that you can ring the professional's advice line and share your concerns, but always follow it up in writing. And that's different to children's social care. But always follow it up in writing to make sure that you've got an evidence base of the concerns that you've raised. Next slide, please. So what are the possible outcomes once you've raised a safeguarding concern, and I'm sure many of you have done that? What happens when it hits adult social care, for example? So within the Care Act, it talks about what the next steps. So your safeguarding concern that meets the Care Act criteria, so the 3 criteria that we've just described. Once that's been identified from adult social care, and that's sometimes based on the quality of your concern that you're raising, adult social care have got a responsibility to make inquiries or cause others to make inquiries to understand what action needs to be taken and by whom to keep the individual safe. So sometimes that's called a Section 42.2 inquiry, and you may be asked by adult social care to undertake this inquiry on behalf of them. I would err on the side of caution if you are to receive a request to undertake a Section 42 inquiry that you think you're the right agency to do that. Sometimes I've known adult social care perhaps cause an inquiry to colleagues in primary care where there's a matter that involves family relations. You've got to ask yourself if you're best placed to be able to do that. And that might be a conversation with adult social care to say, actually, we don't feel we're the best agency to do that. If they are asking you to undertake a Section 42 inquiry because of the care you've delivered to that individual and there's concerns about that from an abuse and neglect perspective, I would say absolutely that it would be within your remit to undertake that inquiry. Okay, but the whole purpose of these inquiries is to establish what action needs to be taken and by whom to keep the person safe. Sometimes when it comes to care homes, for example, the provider of the care home is asked to undertake that inquiry because they're the person that's going to take action to keep that individual safe. Okay. You could also have a safeguarding concern that adult social care deems not to meet the Care Act criteria, so where they don't recognise that the person's got care and support needs or that they're not at risk of abuse and neglect. Sometimes that might be accurate, but other times it might be that that individual, regardless of whether they've got care and support needs and are unable to protect themselves, they might still need some intervention. There might still be a lot of risks around that individual or a lot of risks around the people that they're associated with as a result of their care and support needs, for example. If that's the case, the local authority are able to undertake an inquiry. Remember, an inquiry is about what action needs to be taken and by whom to keep somebody safe. They can undertake an inquiry because they've been given that duty by the Care Act to do so. That again means that if you've got a safeguarding concern that you share with the local authority and the local authority say, we don't think it meets that criteria, but you've got concerns about the risks to this person, you can ask the local authority to review that under safeguarding other So it's not a statutory duty, but it's a duty that they hold, that they can do should they be asked to do so if there's risks for an individual. Okay, so what are the expectations? So a robust concern form identifies risks and actions to mitigate those risks. If you're asked to undertake a Section 42 inquiry, you do so within the given timeframes if it's appropriate for you to do so. You've got to share your information in a legally literate way, as we've described earlier. The Care Act provides that framework for you to share concerns about somebody who's an adult at risk. Really important, though, is if you are raising a safeguarding concern, one of the big expectations is that you receive feedback from the local authority about that concern. Now, there's many people in here that I would expect that have probably raised concerns and not had any outcome. They don't know what's happened with that concern. So that's a responsibility that you've got to make sure that once you've raised a concern, you don't just leave it at that you're actually getting an outcome of what's happened of that concern. The local authority should be providing everybody who raises a safeguarding concern with feedback on the outcomes. Unfortunately, we know that that's a bit of a problem at the moment, and sometimes people are having to request that outcome rather than it being given freely. If that's the case, I would kind of log that, and you can always feed it back to us at the ICB, so when we go to multi-agency meetings we can feed that in. But it's really your responsibility to make sure that if you're raising a concern that you know what happens to that. And also you can escalate your concerns where you believe that appropriate safeguarding actions not being taken or the correct process is being followed. So I'm not going to go into that too much because Laura's going to talk to you a little bit about that next. Okay, so back to our case study. If we remember that we've got a 62-year-old male, he's got a range of physical health needs including poorly managed diabetes, recently bereaved, previously documented concerns around self-neglect, not accessing primary care services, fire risks, antisocial behaviour, and you've been asked to attend a VARM meeting organised by Housing. Just move on, please. With that scenario, what are the questions that you need to be asking yourself around that whole process? Okay, so you need to establish, is this an adult at risk? So you've been asked to attend a multi-agency meeting. What are you starting to think? Is it an adult at risk? So I think we've probably established that, yes, this is an adult at risk based on what we know. Okay. Next step, have the correct processes been followed? So has this gone through safeguarding? So you've been asked by Housing to attend a safeguarding multi-agency meeting, but has it gone through safeguarding? So what we know sometimes is that multi-agency meetings may well be arranged, but actually, because of a lack of understanding, it might not have been recorded as a safeguarding concern. So you need to be asking yourself, is this a safeguarding process that's happened, and has it been recorded with adult social care that somebody's got concerns about this individual? So the next step is that in this scenario, you've got somebody who's been previously recorded as self-neglecting. So within Sheffield, we have got a multi-agency self-neglect policy. That self-neglect policy provides you guidance on what self-neglect might look like, what actions you might need to take, and it also talks to you about vulnerable adults, risk management model, VARM, and complex case management. So what you need to be asking yourself with this scenario is the VARM meeting that's been organised by Housing should alert you to some concerns. It's been organised by Housing. So has it gone through safeguarding because it's been organised by Housing? You would expect that if somebody's at high risk of death, which is effectively what VARM is, from self-neglect, that there would be a safeguarding oversight from this. So that should alert you to just checking the process to make sure that safeguarding concerns have been identified for that individual and that the correct processes are being followed. If you suspect that once you've been invited to that meeting that safeguarding concerns haven't been followed, safeguarding concerns should be raised. And there's nothing stopping you raising that safeguarding concern if you're aware of concerns around self-neglect for this individual and no other safeguarding concerns being raised. So you need to ask yourself then if it is appropriate that you attend this meeting. Is everybody working effectively? Are risks being addressed or are they increasing? Do you disagree with what's happening? Is everybody being professionally curious? So if you go to that meeting, these are some of the things that you should be asking yourself in line with knowing that the criteria for a safeguarding concern has been met and multi-agency working needs to be effective. Next slide, please. So Laura's just going to talk to you briefly about escalation. So once you get to the point of being involved in raising safeguarding concerns and any meetings that you come to, if you've got problems with that, what do you do next? How do you make your voice known if you've got these concerns?
Thanks, Kitty. I'm going to really go through this as quickly as I can because I appreciate we're eating into your break time. So as a referrer of an adult safeguarding concern, as Kitty's already explained, you should expect to receive an outcome from adult social care and a rationale for how that decision making's been reached. An outcome's really important for us in safeguarding because it allows us to consider whether we agree with that outcome and to consider whether we feel that outcome addresses the risks that we've identified in that concern. So if we disagree with that outcome or we don't feel that that outcome supports making safeguarding personal, what that adult wanted to happen, or that it minimises or mitigates risk, there's an agreed escalation and resolution protocol in Sheffield that enables us to challenge that outcome and that decision making. So the protocol relates to the resolution of professional disagreements, specifically to the safety of adults at risk of abuse and neglect. And it allows all agencies that play a role in safeguarding adults to escalate their concerns for any individual at risk. Next slide, please. So I'm not going to go through all of this because you'll get a copy of these slides, but the escalation and resolution protocol follows a stepped approach as outlined on this slide. So it starts at the lowest level, which would be a discussion between workers. So that would be yourself as the referrer and the social worker or social practitioner that screened that referral and came to that outcome. If a resolution couldn't be reached, we would move to stage 2 and then stage 3 and then stage 4. So again, I'll not go through that in detail because I'm mindful of time. So what are the principles of effective escalation? So if we don't agree with an outcome, if we want to challenge that decision making that outcome's been informed by, we need to consider the individual at the centre of that. Wherever possible, we need to try and resolve those disagreements at the lowest level in that stepped approach. The adult's wishes and their desired outcomes need to be central to how those disagreements are resolved. And we must always be prepared to have an open mind when we're holding those discussions. We need to respect the views of others, whatever their level of experience or the role that they fulfill or agency that they work with. And we all have a shared responsibility to solve problems and resolve disagreements because that's how we advocate best for the people that we're trying to safeguard. And just as a final one, make sure that all actions you take, all discussions you hold, all responses are really accurately recorded. So the escalation and resolution protocol, which will talk you through all of this in much more detail than I have today, can be found on this link. So please do have a look at it, and please do remember that escalation is a really positive thing because we're advocating for the most vulnerable people in our society. And this is just a slide with our contact details on. So for myself and for Kitty, for Amy Lampard, who's our designated doctor for safeguarding adults, and our generic safeguarding team email that you can use for safeguarding concerns, queries for adults and children. Thank you.